Night blindness. Introduction. Night blindness, also known as nyctalopia, is a vision impairment that affects the ability to see in low light or dark conditions. It is not a disease in itself but a symptom of underlying eye conditions. Night blindness can significantly impact daily life, making it difficult to drive at night, move safely in dim environments, and perform tasks requiring clear vision in low light. Understanding its causes, symptoms, and treatment is essential for proper management. Definitions. According to the American Academy of Ophthalmology, night blindness is the inability to see well in poor light or darkness due to defects in the retina, particularly in rod cells responsible for low light vision. According to the World Health Organization, WHO, night blindness is a visual impairment characterized by reduced ability to see in dim light or darkness, often caused by vitamin A deficiency, retinal disorders, or genetic conditions. Risk factors. Genetic factors. Family history of retinal diseases, example retinitis pigmentosa, can significantly increase the likelihood of developing night blindness. Inherited disorders affecting photoreceptor cells, particularly the rod cells, can disrupt low light vision. Nutritional factors. Vitamin A deficiency, a common cause of night blindness, results in the inadequate production of rhodopsin, a pigment necessary for night vision. Poor diet lacking essential nutrients, such as zinc and omega-3 fatty acids, can also impact retinal function and adaptation to darkness. Medical and systemic conditions. Diabetes, diabetic retinopathy, damage to retinal blood vessels can impair vision in low light. Glaucoma and its treatment, medications used to reduce intraocular pressure may affect pupil dilation and night vision. Cataracts, the clouding of the lens prevents sufficient light from reaching the retina, affecting visibility in dim lighting. Retinitis pigmentosa, a genetic disorder that causes progressive degeneration of the retina, severely impacting night vision. Environmental and lifestyle factors. Prolonged exposure to bright lights can damage retinal cells, leading to night blindness. Excessive screen time may cause digital eye strain, reducing the eye's ability to adapt to darkness. Aging-related degeneration of photoreceptor cells naturally contributes to diminished night vision. Etiology. Night blindness can arise from several causes. Vitamin A deficiency leads to improper functioning of rod cells in the retina, impairing the ability to see in low light. Retinal disorders, conditions such as retinitis pigmentosa damage the retina, affecting rod cell function and adaptability. Cataracts, the clouding of the lens prevents adequate light from reaching the retina, leading to poor vision in dim settings. Glaucoma and its treatment, medications such as miotic eye drops reduce pupil size, limiting the amount of light entering the eye. Diabetic retinopathy, damage to the small blood vessels in the retina disrupts light detection and transmission. Congenital night blindness, a genetic condition present from birth, affecting the retina's ability to adapt to darkness. Types. Congenital night blindness, present from birth, usually due to genetic mutations affecting retinal function, particularly rod cells. Progressive night blindness, worsens over time, commonly seen in degenerative retinal diseases such as retinitis pigmentosa. Temporary night blindness, caused by reversible conditions like vitamin A deficiency, prolonged bright light exposure, or certain medications. Pathophysiology. Retinal pigment abnormalities, accumulation of defective pigment disrupts light transmission, affecting dark adaptation. Optic nerve impairment, damage to the optic nerve interferes with the transmission of visual signals from the retina to the brain. Lens opacity, cataracts blocks sufficient light from reaching the retina, causing blurred night vision. Rod cell dysfunction, rod cells in the retina, responsible for vision in low light, fail to function properly due to vitamin A deficiency or genetic mutations. Role of vitamin A in night vision. Vitamin A intake, from food like carrots, dairy, and fish. Down arrow. Conversion to 11-cis retinal, inside the retina. Down arrow. Formation of rhodopsin, 11-cis retinal plus opsin equals rhodopsin. Down arrow. Light absorption, rhodopsin absorbs light, changing 11-cis retinal to all trans-retinal. Down arrow. Signal transmission to brain, optic nerve sends visual signals to the brain. Down arrow. Rhodopsin regeneration, all trans-retinal converts back to 11-cis retinal with vitamin A. Down arrow. Continuous night vision, cycle repeats to help in low light vision. Clinical manifestations. Difficulty seeing in dim or dark environments, the most common symptom of night blindness. Slow adaptation to darkness, vision takes longer to adjust when transitioning from a bright to a dark environment. Blurred vision at night, objects appear hazy or indistinct in low light conditions. Increased sensitivity to glare, bright lights from headlights or street lamps cause discomfort and reduced visibility. Poor peripheral vision in low light conditions, tunnel vision may develop in some cases. Diagnostic evaluation. History taking. Chief complaints: patients report trouble seeing in the dark, difficulty driving at night, or frequent stumbling in low light areas. Family and medical history includes history of retinal diseases, dietary habits, or systemic illnesses like diabetes. Physical examination. Visual acuity test assesses overall clarity of vision. Dark adaptation test evaluates the time taken for the eyes to adjust from bright to dark conditions. Fundoscopy, ophthalmoscopy, examines the retina for signs of degeneration or abnormalities. Laboratory and imaging tests. Vitamin A blood test determines nutritional deficiencies. Electroretinogram, ERG, measures the electrical response of the retina's rod and cone cells. OCT, optical coherence tomography, provides detailed imaging of retinal layers. Genetic testing identifies inherited retinal disorders like retinitis pigmentosa. Medical management. Pharmacological treatment. Vitamin A supplements, essential for treating deficiency-related night blindness. Antioxidants, lutein, zeaxanthin, omega-3s help in retinal health and slowing disease progression. Surgical management. Cataract surgery clears the lens to restore vision. Laser therapy for retinal diseases treats conditions like diabetic retinopathy. Nursing management. Assessment. Diagnosis. Intervention. Difficulty seeing at night, assess the patient's vision, especially in low light conditions. Risk for impaired vision. Encourage proper lighting at home and work, such as using night lamps and well-lit pathways. Signs of vitamin A deficiency: dry eyes, blurry vision, eye fatigue. Risk for vision loss due to vitamin A deficiency. Provide dietary education on vitamin A-rich foods, carrots, spinach, dairy products, and recommend supplements if needed. Slow adaptation to darkness, observe if the patient takes longer to adjust from bright to dim environments. Impaired dark adaptation. Advise reducing exposure to bright lights before going into dark environments to improve adaptation. Difficulty driving at night, patient reports trouble seeing road signs, pedestrians, or other vehicles in dim lighting. Risk for injury due to poor night vision. Recommend avoiding night driving and using anti-glare lenses or adaptive headlights. Psychosocial impact, assess emotional distress, anxiety, or fear related to vision loss. Anxiety and fear due to visual impairment. Provide psychological support, encourage regular eye check UPS, and reassure the patient about available treatments. History of retinal diseases, family history or previous eye conditions affecting vision. Risk for progressive vision loss. Encourage regular ophthalmologic check UPS and early intervention strategies to prevent worsening of symptoms. Prevention. Balanced diet, ensure adequate intake of vitamin A and essential nutrients. Regular eye check UPS, early detection of retinal disorders. Manage underlying conditions, control diabetes and other systemic diseases. Protect eyes from excessive light exposure, wear sunglasses in bright sunlight. Limit screen time, reduce strain on the eyes. Use proper lighting, ensure well-lit environments at home and work. Genetic counseling, for individuals with a family history of retinal diseases. Complications. Permanent vision impairment if untreated. Increased risk of falls and injuries due to poor night vision. Difficulty in driving or working in low light conditions. Psychological distress and reduced quality of life. Progression to complete blindness in severe retinal diseases.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.